Well, good morning, everybody. Jeff Slakey here on the Daybreak Show. I have a great guest to introduce you to and talk with today here from the school district, Crystal Pooler. Good morning to you.
Good morning.
Nice to have you here on the show and kind of talking today about your role in the district as one of two of the school and school district nurses for the Shelton School District. First things first, tell us a little bit about yourself, your background, and you're recent to the school district.
I am recent to the school district. As you said, my name is Crystal. I started with the school district this year, so September 1st or so. Been a nurse since 2007. I've been telling people this, but basically was told be a school nurse, it'll be fun. And so my past experience with nursing has been with home health and palliative care nursing. And so this is a complete change. And
Sure.
so it's been a learning experience for sure.
When it comes to the prior experience and your interaction with patients, give me kind of a number that maybe you would see on an average day.
Previously or
Yeah,
okay, so
previously.
typical like home health hospice visits is like 4 to 6 patients a day, depending on their acuity and location.
Uh-huh. And now you, in addition to the other school nurse, are responsible for roughly 4,000 kids across a multitude of schools.
Correct.
And I can see how that would be quite a change of pace for you.
Yes, definitely, definitely.
A lot of folks, and we talk about the school district a lot here on the show, and we talk to the teachers and administrators and things like that. And one thing that I've come to find out and come to understand is obviously schooling and education is much different from when I was in elementary school or when other listeners over the years have been in schools. And nursing is another one of these aspects of the district of schools that has really transformed over the decades. What are some of the most common, I guess, misconceptions people may have of what a school nurse either used to do and does not any longer do, or what they do now compared to back in my day when I was in school and our school nurse, dot, dot, dot.
Right. So, I had no idea what a school nurse did. My assumption was like the Band-Aid thing,
Uh huh.
ice pack, and you go back to class. And I think we still do that. We still do basic first aid. But I think the student population has changed. Kids are coming to school sicker because their chronic conditions are allowing them to live longer and they need to be in school. So we see a lot of chronic health conditions that we help to manage, and we do a lot of care coordination and navigating with primary care doctors, with parents, with specialists to maintain safety at school.
You never know when a student or where a student is going to get sick. So, how does that work? Do you work out of a central school or the school district office, and then when you get a call, you go to that school and meet with that student, or?
So usually, what it looks like is I'm at the high school for 3 days a week, and then 1 day a week at OBJ, and 1 day a week at the Choice Alternative School. So usually, the ideal is that we're at the school for the whole day that we go. But I have been pulled from the high school to other schools if they call. The majority of kids come to the health room. So most of the schools have a health room, and that's where the health aide is, and where the nurse will be if they're there that day. And then they come in, we triage what they have going on, give them medication or treat them, send them back to class or whatever we need to do. Or we'll get calls from teachers or admin saying there's an emergency here, please come, or this kid is, can you come assess this student or something like that.
We hear a lot of times when folks outside of in adult situations, when they get sick or ill or something happens, the fire department comes and then EMS comes. And EMS sometimes will act as kind of that first care provider because they lack the type of medical insurance needs to keep them from going to a hospital and getting checkups. Do, are those the types of things that you work with? I mean, you don't ask for insurance cards or anything like that with the kids, but do you get a sense that if there's struggles with health insurance at home, some of those ailments they may have are brought to the school?
Absolutely. And I also think that there's a misconception that the school nurse operates like out of a clinic. Like we could have that same, we could give immunizations, we can, treat certain things, and we can't. If a school has a health-based clinic, that's a different thing, and some do. And that requires a doctor, which we don't have.
Uh-huh.
And so there are a lot of kids that will come in, oh, my mom said to come in and get some medicine for this or do that. And so there's a lot of education around what we can and can't do. We can't, we honestly, we can't give kids cough drops.
Okay.
I mean, we cannot give anybody anything with an active ingredient unless there's a doctor's order. And so parents, I think, get frustrated a little bit with that because then they have to make an appointment or contact their doctor. We do the best we can, but they won't release as much information to us. If we do have a student come in, and this is, part of that nurse role, is they've been coming in a lot. Like, what's going on here? Or, you've had a stomach ache for 2 weeks now. Have you gone to the doctor? And kind of trying to figure out and navigate why. What's going on? Why aren't they getting seen? Or why isn't this resolving? And then finding out, oh, maybe they don't have insurance, or maybe they never told their parents, and figuring out a plan after that. Okay, well, they don't have the money for it. We get resources involved. We let social work and counselors and get those avenues open to the students.
Coming up is something that we've talked not only about with the Shelton School District, but many districts across the county, is the upcoming levies. And one of the things that keeps coming up are the types of positions that are currently within the school district that on paper, according to some legislative decisions, you are fulfilling a certain need, but if you're on the boots on the ground, as it were, you know that the numbers are not as helpful as they could be. We talk about two nurses for a 4,000 student school district here in Shelton. These levy dollars are one of the ways these levy dollars could be used is to help add to that for medical resources. Is that right? What's the number that either you're supposed to be at statewide, statewise, and what's the number that you think probably you should be at for the benefit of the students?
Well, I think more nurses is better. But like you said, you can make all the recommendations you want at the state level to say you should have this many nurses, but the state's not providing the funding to do that.
Yeah.
And so it's a fine line of saying, all right, well, for the safety of the students, it's recommended that you have, say, one nurse per 700 kids. But there's very few districts out there that would be able to even come close to budgeting that. And so the levy is what helps to add some of that additional funding to maintain the nursing numbers that the school has. And without it, there'd be no possibility of getting more nurses in the future because, as I've been informed, and I'm so new to the school district and levies and what this stuff means, is that, yes, we probably should have more nurses out there in most of the school districts, but where's that money coming from? The levy is one of the places where some of that money can come from, and that's why it's so important.
As we continue to talk over the next many months on stuff happening health-wise in the district, we'll have other topics, of course, and I think the next one we're going to key in on is how we have kids, many kids, all in tight quarters in these different schools, but immunizations is always a hot topic when it comes to these types of things, and public education versus the good of the public versus people's personal choices on that. So that'll be a fascinating conversation on how you guys kind of navigate that, and we'll just kind of continue to go down and just let people know what the role of the school nurses are for medical needs for the students. Crystal, it was nice to meet you. And
Thank you.
thanks for coming on, and we'll look forward to keeping to talk about these once a month or so.
Okay, and then just also that it's myself and the other nurse, Amy Frost, who's
Okay.
been with the district since 2014, along with these, radio broadcasts. She'll also be doing, updating the website and making sure that there's articles in the paper that kind of go over the same things.
Oh,
So
good.
we'll kind of be mirroring each other in different avenues
Yeah.
for that.
Cool. Well, very good. Again, Crystal Pooler with the district, talking some of the health needs for the Shelton School District. Thanks again.
All right, thank you.